Hello everyone, my name's Stephanie Jones and I'm here to present to you my internship during the spring 2021 semester at Upstate Veterinary Specialties. I'm going to breeze through this presentation because I have a lot to say and the presentation is rather long. My first take on this presentation was actually an hour and 10 minutes. So I'm redoing it and going to try to keep it within the time frame suggested. So let's get started. One thing I will mention is I will include a PDF of the presentation since I'm going to go through this quickly if there's anything you want to review. Introductions. This internship was amazing, obviously, since I have a lot to say. I was an intern as a LVT. Upstate Veterinary Specialties is a really awesome clinic. They're 24-hour emergency care and also offer many specialty services to their clients and their patients. So the mission of Upstate Veterinary Specialties, as it says here, is obviously to help patients live longer lives and be happy. And we do that through compassionate care and expert medical care. Pictured here is Heather Flynn. I do want to give a shout out to her. She was a real integral part to the success of this internship. She provided a lot of support throughout the internship, as well as a lot of training tools for us to use. So that was very valuable, and I thank her for that very, very much. One thing to note is that this internship was a little bit different than most internships because of the COVID changes. That eventually will go back to normal, but at this point we're just having curbside service, so no clients are in the building. However, we do get a lot of experience in talking to clients and discussing histories and information that we need for their records via phone or by speaking to them in the parking lot. My first rotation was in neurology. I'm going to highlight in each department some of the responsibilities of a technician, but these are by far not all of their responsibilities, as I'm sure you're all aware. But I just wanted to highlight the differences in each department. Of course, in every department, there's history and SOAPs and TPRs and physical exams. The physical exams are different in each department based on what they're looking for. In your ER department, obviously it's basic, but in neurology, you're looking for reflexes. You want to check out to see if there's any lag or lack of reflexes in any of the animal's anatomy. So that is a big issue, and what is needed to be done is restraint. So restraint needs to be done properly so that Dr. Todd Bishop can handle that animal in the proper way to be able to assess his neurological findings. Some common chief complaints, these are by far not all of them, but seizures, ataxia, limb lameness, and weakness. One of the things I really enjoyed about this rotation is Dr. Todd Bishop's wealth of knowledge about not only his field in terms of neurology, his specialty, but also everything related to veterinary medicine. One of the things he taught me was that neurological classifications have 3 different categories: structural, metabolical, and function, and this helps in finding the diagnosis. As I mentioned, examinations, it's important on evaluating postures and reflexes and anything related to the nerves and sensory. One of the things he taught me that I really liked was a tactic that he was taught in school and that he uses as well, called MIND, which is an acronym for different possibilities to keep in mind for potential, not necessarily diagnoses, but sort of like the breadcrumbs that lead you to the diagnosis. So that was really interesting, and it's an easy way to remember. I had an interesting case study here. This particular case, I was able to participate in the surgery. And this was a dachshund, 10 years old, came in through ER with, basically it was a down dog, paraplegia. One of the things to mention is that in neurology, MRI is used. So after the patient has been assessed and it's determined that an MRI is needed, that animal is set up under anesthesia in order to get the MRI done, as you saw in the original first photo of Tabor in the MRI machine, monitoring anesthesia. And once the MRI is done, Dr. Todd Bishop is able to determine where the problem spots are and if surgery is needed. In this case, it was. The owner is notified and a decision is made whether or not to send them to surgery. Surgery happens right after the MRI is done to be most efficient because the animal is already under anesthesia. In this case, you can see the pinching of the spine here in this top photo, and as well to the right, this mushroom shape coming out of the spinal column here, which is the disc that is causing the pain and compression. Down at the bottom, you can see this 1 centimeter disc that came out and how it's mushroomed at the top there, causing all of this pain in this dog. If you think about it, this tiny 1 centimeter little piece of tissue caused this dog to not walk. That's significant. So some interesting things that I found there. Rehab was really fun. The techniques are a little bit different in this case because you're seeing the animals often. They come in weekly or monthly, however they want it set up. So you want to keep the animal happy, and that's what this place is. You play with them, you get to know them, but also you need to make sure that you restrain them very well. It's very important for this department because you're manipulating them in a neuromuscular and skeletal exam fashion. But a lot of fear-free techniques are used, which is Lauren Krause, the assistant in this department, is fear-free certified. And Jen Wolf is actually certified in rehabilitation as an LVT. Dr. Prez is absolutely amazing. She knows so much about rehab. She not only uses the treadmill to help build muscle, but she also uses these really fun-looking balls, inflatables that you see in the photo here, and laser therapy. The most common complaints, there's many different ones, but surgically would be TPLOs and spinal surgeries that animals need to recover from and rebuild their muscle. And non-surgical would be like hind end weakness, ataxia, arthritis management, and then conservative management of injuries. We also saw animals that needed to be conditioned for sport animals, sporting dogs who do a lot of physical work. One of the disease processes that I learned about in this department that is seen a lot is GOLP, which is geriatric onset laryngeal paralysis polyneuropathy. A mouthful, but it's pretty interesting. Basically, the nerves are degenerating, and they're progressively degenerating, especially around the causing laryngeal paralysis. So there's that stridor cough that you hear, and there's a lot of issues with exhaustion and exercise intolerance and such. So one of the things I also learned is that if you don't use it, you lose it, which is one common term that they used. You have to slowly build your muscles, and it's things you got to just continue on. Additional therapies are acupuncture and laser therapy were things that were done within this department, which were really fun to watch. Emergency day shift, super fun department, so much happening, but it wasn't as stressful as I thought it was going to be. I had gone into this internship being a little bit afraid of emergency, but it's really not scary at all in terms of everybody. There's several people there that all want to help the animal, and you can bounce things off each other. It's really a team effort, and it actually made it a lot of fun because if you were doing something and you're unsure about something, someone was right there who knew how to do it. So you always have a team members there that are more knowledgeable than you or work together to figure out the situation, and the doctors are there to help as well. So you never feel that you're lost at all. So that was really fun to experience. I'm not going to go into the way it's run, just because it would take up a lot of time here. I'm trying to cut some of the interesting things I found down. So, but basically it's very, very well organized, and I really enjoyed my time in emergency, and was totally impressed with the programs that are used to keep track of treatments. It's unbelievably organized, and it's hard to miss treatments. You really almost have to try to miss something. So, and there's so many people there to help. So it really runs very, very smoothly. Again, this is the program Instinct that helped us take care of treatments. It runs on an hourly basis, and you just go through and check off each thing. And every hour you have your treatments for your animals. You're assigned animals during the beginning of your shift, and those are the animals you take care of. And it's usually 6 patients per tech. Critical patients count as 2 patients. So they try to make sure to maintain a quality of care while still being able to take in animals. If it starts to become overwhelming and goes above that number, they close the department shortly until they can catch up, and then eventually let new patients in. It's really organized, and it's a great way to stay on top of caring for everybody to make sure everyone gets excellent treatment, which they really, really do. An interesting case study in day shift was a Morkie who was attacked by his littermate. It was actually not an attack. They were playing, and it was totally an innocent thing. So obviously this animal had proptosis of the right eye, and the veterinarian, Dr. Little, was really talented at being able to take care of this eye. Basically, she sutured small little rubber tubings to the eyelids to keep them, to be able to sew them together and not irritate the eye. So she used the suture to go through the tubing and keep the eye closed so it could heal back into itself. Eventually the animal did heal and started to move its eyelid. So, or its eye, and the swelling did go down. There was cataract on the eye, so there was a little bit of vision problems, but ultimately had a great recovery. The night shift, I had to really push through this one. I believe for this presentation, it's important to mention some of the struggles that I had during this internship. Definitely would be the night shifts. Not so much that I couldn't do it. It was that my lifestyle with my children made it hard. I'm sure over time I would be okay, but it was a bit of an adjustment, especially since my little girls just love climbing in bed with me. So it was really hard to get caught up on sleep. But overall, it was a great experience. Night shifts run a little differently. Basically, you want to focus on stabilizing those patients and caring for the ones that are staying overnight, so that in the morning, the specialists, when they come in, can either evaluate or take care of any situations going on with those patients that might need it. So it's really all about just, getting the emergencies in, evaluating them, and getting them under control. Again, I tip my hat to the crew that handles the night shift. It was rough for me to complete, but I'm very glad I did it. I have major, major respect and appreciation for the team that works. They are on top of everything and they move and they get things done. And it's just unbelievable to me how talented these crew members are and still be able to maintain being awake and alert during these late hours. So we had a lot of interesting experiences. One of the emergencies that came in was euthanasia, actually. But unfortunately, the owner actually had heart pain, so was sent to the hospital, and we had to keep the dog overnight. It was very sad, but the dog was fine, and the owner eventually was fine. So that was taken care of, but it was a little hectic with the ambulance showing up at the time and lots going on. But there are some crazy things that can happen at night. Internal medicine was one of my favorite rotations. This and oncology were probably one of my top ones, but honestly, I can't say that I disliked any of them. It was so much fun that it's really hard for me to differentiate. I would leave a department and say, this one's my favorite. And then I would go to another department and say, this one's my favorite. So I'm sure everybody thought I was just totally crazy and trying to amuse them, but it was true. I absolutely loved every department. It was like soaking up all this knowledge. So anyway, internal medicine is really where I shined due to the technician, Erica, and assistant, also Erica, and Dr. Arnold, who really helped me with my blood draws. They had some really great techniques and tricks for me to use, and by the end of this particular rotation, I was nailing blood draws left and right. It was pretty amazing, and it felt really satisfying. It's really where my internship turned around in terms of confidence in my skills. I started to believe that I can actually do this successfully because with my very much lack of experience, it was a little difficult in the beginning because I wanted to really do things as well as possible. And it's, sometimes I'm hard on myself. So at this point in the rotation, it was excellent. I really got to do a lot of things. Scoping is done in internal medicine, as you can see to the photo to the right. And then, of course, common diseases in internal medicine are gastro, diabetes, pancreatitis, anything that has to do with the internal workings of the animal. Internal medicine, this was such a great case study. 4.5-year-old pit bull. This dog has basically an issue with its bone marrow where it's producing way too many red blood cells. It's polycythemia vera and all kinds of issues that are related to that. If what's done is every month the animal comes in for a PCV. If it's above 65, the animal, a blood transfusion is done. Or, I'm sorry, not a blood transfusion, a phlebotomy. In this case, the PCV was 61%, which was close enough to 65 where they had to assess the owner and know that he doesn't always make his appointments. So they wanted to make sure this dog was covered for another month. So we removed 480 mLs of blood and replaced it with fluid. It was crazy to me to see that. That was exciting and also a little bit shocking for me, pulling that much out of an animal and having it just stand right up at the end, totally fine and happy. It was pretty amazing. This was a fun case study. This was one of my first internal medicine. Of course, it's a foreign body. We had to scope this dog. This puppy gets into a lot of trouble. And we pulled out 3 rubber balls, all with smiley faces on them. It was really fun. And additional fabric from stuffing from a tennis ball. The dog was fine at the end. Surgery. Oh, surgery was fun. So, um, just as a little joke, I had sent this photo to my husband to tell him I was having a wonderful lunch that day. But no, actually, this is a splenic tumor that was removed, and it was really awesome to watch. Um, with surgery, uh, there's different responsibilities that are done as a technician. Obviously, you have a lot of anesthesia, CRIs, pre-meds, pre-op, all these things that need to be done in terms related to surgery. And then, of course, you have pre-op rads and post-op rads. All of these need to be done in order to properly assess the patient and maintain a proper level of anesthesia during the procedure. One of the most common complaints or surgeries that are done are TPLOs, which is where they put this plate in on the bone, and then other therapeutic surgeries and mass removals. I would say that this department would have been probably my all-time favorite 20 years ago. I really, really, really enjoyed it, and it was so fun to watch. I was soaking up all of the information, but they were long hours on your feet all day, and that made it a little difficult. But overall, it was super fun, and Tom, the head technician in that department, really knows his stuff. He's amazing, and he made ventilators much less frightening for me. Cardiology was really fun. Dr. Cassidy really knows his stuff, and he's certified in the specialties of this department. The typical responsibilities of the technician are working with the doctor on echocardiograms, restraint. I learned very quickly that it's very important to hold the bottom leg, otherwise the dog or cat will just pop right up. So that's one thing I learned. They have take-home ECG harnesses, and when those ECG harnesses come back, you have to really assess the data that came back and make sure that everything was read correctly. This takes some time to do for the technician to do. Also, procedures are often done in fluoroscopy because you want to be able to have constant radiation in order to basically live view the heart when you're performing procedures. The only issue, it's not an issue, but it's for our protection, is you have to wear PPE. Lead vests and thyroid shields. This is so important, especially in this room. However, it does get a little bit heavy, but it's well worth it because of the risk that you could be under having live radiation pumped towards you all the time. Cardiology, common complaints are lethargy, difficult breathing, heart murmurs, ASC, PDAs. There was a particular case study that I was looking at. I wasn't really involved in it, but I read, Amy, the technician, told me about it and showed me these great photos of this septal defect. You can see of the flow of blood going in past, causing tricuspid regurg, and this ends up enlarging the right atrium, which changes the pressure in the heart, and this causes a lot of problems for the animal. We had a case study of a 6-month-old Chihuahua mix. This puppy had a pulmonic stenosis, and basically part of the heart was essentially not shaped correctly. It was sort of pinched. If you look at this picture over to the right, using saline contrast and then also angiograms before and after, you can see this bulge that is basically pinched right below it that changes the pressure in the heart. And what's done is a palliative pulmonic balloon valvuloplasty, which is a long way of saying basically a balloon is put in, you work it around the heart, and then you blow up the balloon. It sounds simple, but it's not. You must be very careful. Ophthalmology, this department was super fun. We got to see a lot of really cool things. Obviously, there's a lot of eye removals. The first day I was in this department, I jumped right into surgery. So I got to see a lot of cherry eye surgeries. That was the week for cherry eye surgeries. Additionally, with exams, you need to be careful of the way you hold the animal's head. This was the other thing that the technician Mark taught me. If you put too much pressure on the neck when you're helping hold the animal, it changes the ocular pressure, and this can change your values on the tonometer. So that's important to pay attention to. Again, as I said, you are the apple of my eye. Not really, you're the cherry of my eye, in this department anyway. There's a lot of dogs that are predisposed in it, and it's obviously one of the most common things that's seen. One of the things I did want to mention that Mark had mentioned, one of the biggest mistakes that they've seen in non-specialty clinics is that in all the textbooks and everywhere it says 15 to 20 millimeters on the Schirmer's tear test is fine. Really, you don't want to go below 20. So if it's below 20, you should really think about possible treatments or sending it to a specialist. And you don't squeeze the neck, like I mentioned. Ocular pressure is an issue here. And also, they often see a lot of things diagnosed or believed to be conjunctivitis. Not everything is conjunctivitis. Another case study, 7-month-old English Bulldog, male, intact, cherry eye. As I mentioned, it was cherry eye week. Basically, they sutured this back into position, and it was really cool to see. You can see the tumors in the top right as well on the eyelid, which were cut off and sutured back together. And you see in the bottom right how beautiful and clean this eye looks now. This was on both sides of the eye, so both eyes had to be done. Oncology, by far my most favorite department, in a very close with internal medicine. This had everything I had anticipated in it that I was hoping to see and do and learn about. The real basis for oncology that I enjoyed at SUNY Delhi was immunology, genetics, clin tech, anatomy, anything related to internal medicine of the body. A lot of this has to do with oncology and how you administer medications. I love cell signaling, that has a lot to do with it, and microbiology, all of those little things. So that was the basis, is really kind of the foundation you need to specialize in this. And I seriously have learned so much in this department that I have determined that this is what I want to specialize in. This and internal medicine are my two top picks, and oncology is number one. So as my career moves forward, this is where I'm headed. Whether I become a veterinarian or I stay a technician, it's going to be in these departments. I'm very excited about that. It's pretty amazing. So there's some dangerous drugs in this department. They're very toxic. They're toxic for a reason. They're designed that way. We want to kill these bad cells. Unfortunately, they also kill healthy cells, and they can kill your cells as a human. So you must be careful. Lots of PPE, and you have to be extremely careful at administering these drugs. I'm going to breeze through this because I had a lot to say about this department, but I do just want to kind of give a quick summary of the things that I learned. The most important thing in veterinary oncology, this is medical oncology. So we're not talking about radiation here. We're talking about medically treating these patients. And the goal is remission, not a cure. We're not looking to put these animals with already shorter lifespan than a human has through this intense treatment that's going to cause all kinds of metabolic and physiological issues in their system, to have them feel miserable and then possibly cure them for a few extra years of their life, or maybe more, but ultimately they do have a shorter lifespan. So our goal is to make them feel better for as long as possible. It's the quality of life we're looking for. Oftentimes treatments, protocols use more than one drug, and this is to avoid drug resistance that eventually does occur. And one of the procedures or protocols that is set up is CHOP, and that has to do with the medications that are administered, P being the prednisone, which is actually a steroid, and this helps slow down the process of cells basically reproducing themselves. Cerenia is often also given as an anti-nausea, and to just kind of help them through the process of the chemotherapy for the days after. Case studies. So this was a German Shepherd who actually was diagnosed with intermediate to large cell lymphoma, which is a common disease that occurs in oncology. Was doing great, but came out of remission. They started Elspar. Elspar is an enzyme that actually reduces the cells from duplicating, and in conjunction with prednisone really helps. It sort of induces remission when you start a protocol. So the first treatment was CHOP, and they did great. When the animals started to go out of remission in February 2021, they basically started a new treatment. It did develop non-regenerative anemia, as well as many other issues, but with a new treatment with different drug combinations. Again, like I said, with drug resistance, you just, when the animal comes out of remission, you try, as long as the blood values are okay, which is very important to monitor in this department, you can move on to a different type of treatment given the circumstances. One thing I do want to mention, it's, as I mentioned earlier, PPE is important. You do not want to cover the catheter. The catheter, in this case, you're administering the medication, and you want to take a look at this site. You want to make sure that nothing leaks out. If something leaks out, you need to immediately administer emergency protocols to clean it up, and there's still a good chance that it may be so bad it'll eat away at the tissues that the leg may even have to be amputated from one single drop of this drug. That's how dangerous it is. And they have graduations for animals that complete their chemotherapy protocol. Now, of course, it's just a way to keep the animal in remission, and it's very possible the animal will be back at some point in its life for additional treatment. But that's not always the case. It depends on the type of cancer that is presented. Again, as I mentioned, values are important. Teresa, who is an amazing technician, as well as the assistants in this department, really know their stuff, showed me how blood values are extremely important in terms of determining whether or not an animal can be treated. I won't discuss the MDR mutations, but if you'd like to look it up afterward, I found it extremely fascinating. how you need to pay attention to this. Otherwise, the animal can get very sick if it's given certain chemo drugs or medications based on receptors of the cells and how the drug is processed through the cell. The picture to the right I want to mention is a closed system. Chemotherapy drugs, there's extra protocols in place to keep any drug from being aerosoled or pushed out into the environment outside of the system that we're using it in. And this is to prevent anything from leaking or possibly getting where it should not get and causing harm to any people or animals. Facility management. This facility is amazing in terms of the way it runs things. I have a little bit of a business background, and I can tell you that this place is run like a well-oiled machine. There's not one person I met in this place that didn't say to me, "We have it really good here." And it's true. They really do. And we do, because of the fact that there's clear and concise hierarchy. If you ever have a question or anything at all that you want to talk to somebody about, there's somebody to go to. The facility even has a social worker that works with clients when their pets have passed or are passing, to help them work through emotional distraught and anxieties that go through the process of that. I mean, that's amazing. That's up and coming in veterinary medicine, and it's pretty exciting. They have clear departments, and they're growing. There's construction going on right now where they're growing the facility. That's exciting. That, coming from a person who worked in a field that was actually dying at the time, it's pretty inspiring. It makes you feel really good about where you are in life, because of the fact that not only are you in a field that you love and everything is so interesting, and that may be my newbie baby tech mentality at this point, but it's true. You really see how exciting it is seeing everything working so smoothly and growing in front of your eyes. And they have so many different departments that it really, any question you have, you'd know where to go. And if you don't, you can ask somebody and they'll show you. Everybody's so helpful. They care about you. And it's amazing how I saw people walking around saying, "How are you doing today? Are you okay?" Everybody really cares for each other. And I think that's important in terms of the potential to burn out in this field. It makes you feel really good about where you are. Lessons learned. I'm in the right field. Yay! I finally, at 39, I figured it out. And that had a lot to do with everybody in my life over the last few years. So I can't thank everybody enough for all they've done for me. I've learned that you have to practice. Make sure you hold that bottom leg. It's so satisfying hitting the vein. And I found focus in my life with internal medicine and oncology, and that is very valuable to me. For someone who loves everything about this field, it's amazing that I was able to find a focus and know it's my focus. That's a big deal to me, so I appreciate that, and it gives me real focus on where I want to go. In summary, best internship I've ever experienced, not only because of the things that I learned, but also the valuable experiences and wealth of knowledge that the people in this facility know, and how wonderfully welcoming everybody is, and how everybody wants to teach. That's so valuable to me. Education is a huge focus of mine. It's what keeps me going, honestly, and what I want to portray to my children. So the fact that everybody in this facility wants to teach something, and if you see something cool going on and you aren't busy doing something, they'd love for you to join in and check it out. I mean, it's exciting. I still have a lot to learn, but in this place, I know I will learn it, and it's pretty exciting. And as I mentioned, I have a focus on my career now, so that's a good thing. quick last mention here. Some of you at Delhi know of a folder I created when I was in high school that listed my goals. This was from the guidance counselor, different colleges I was researching, different interests I had. The goals list on the bottom of this folder says, go to SUNY Delhi, become a vet tech, start my own farm. As of now, I have done all three. And over to the photo of the left of this young-looking girl with this calf she's holding on to, giving her WISE presentation. WISE was a program I participated in high school instead of graduating early, where I worked with exploring the field of animals and caring for animals, interning at a zoo and such. Totally rocking those 90s jeans. So these were my goals at the time. So what do you do when you achieved all of your goals? I'm 39, and it's amazed me that I've completed them all. I never thought I would get here. I wouldn't be here without my husband. Well, you can make new ones, right? That's what you do. So I have officially written my new goals, which are to either become a veterinarian and or earn my VTS as a technician. Wherever life takes me, I'm trusting everything happens for a reason, so we'll see what happens there. I would like to write a peer-reviewed article and get published. And I'd love to participate in a scientific study related to veterinary medicine, because I feel research is the key to the success of veterinary medicine. It's constantly changing and morphing, and it's important for all of us to keep moving forward and keep trying new things and exploring what's out there. This photo to the right is of me in South Africa during my trip for SUNY Delhi on Vets in the Wild, and the rock here says, feel the fear and do it anyway. And ever since that moment when I saw that rock and realized I was in South Africa, which I never thought I would be, I have been following that along. And on to new adventures. Some of you may have heard that I'm joining the UVS team. I couldn't be more proud and excited. I am thrilled. And I will be the new specialty floating technician. So I'll get to experience a lot of different things through each department. And this is going to be extremely valuable to me, especially applying to vet school. And to be continued. We will see where the next step takes me, and I'll keep in touch with everyone at SUNY Delhi and keep you posted on everything. So if you have questions, you can meet with me and Cameron on May 4th at 4 o'clock. Just a little funny picture. Never buy a dog when you're tipsy. Most of you who do know me knows I love my cows, and if it wasn't for my husband keeping me under control, this would probably be my house, but luckily it's not. So anyway, thank you everybody for listening. I really appreciate you taking the time. This internship was so valuable to me, and I thank everybody involved, everyone at UVS and everyone at SUNY Delhi. I absolutely loved it, and I'm looking forward to the future. Thank you all.